For the estimated 1 million kids and teens who have peanut allergies, avoiding exposure takes more than just skipping some foods. Reactions can be triggered by something as simple as hugging a person who ate peanuts or touching the same surface. But as Sarah Daloff tells us, a panel of health experts are now recommending a pill to help patients increase their tolerance to peanuts.
A potentially life-saving new peanut allergy medication now one step closer to FDA approval.
I voted yes.
After an advisory panel heard from doctors, researchers, and those living with food allergies.
We are truly never safe. There isn't much that can really prepare you for seeing your child in anaphylaxis.
AR-101 is aimed at 4 to 17-year-olds. It contains a measured dose of peanut flour and works to build a tolerance over time. Not enough to, say, eat a peanut butter sandwich, but instead to protect from accidental exposure.
If there's cross-contamination, if there's something by accident in a product, they won't have a life-threatening allergic reaction and they won't feel bad afterwards and they won't have to go to the emergency room.
If ultimately approved by the FDA, the pill would be the first product of its kind on the market. A small percentage of study participants experienced serious side effects, but 67% were able to eat 2 to 3 peanuts with no allergic reaction.
This is not to say that eating food has been the best outcome of the treatment. The true benefits lie in my comfort and safety.
I have more protection from accidental ingestions.
A victory they'd like to see offered to all kids with severe peanut allergies.
The FDA is expected to hold a final vote next year. While the administration doesn't have to follow the recommendation of the panel, it usually does. Concern is growing among Canadian health officials as the serious lung illness affecting hundreds of Americans who vaped cannabis-based oil continues to rise. This as the country prepares to allow the sale of vaping products in its legal marijuana market. So far, no illnesses have been reported north of the border, but officials are monitoring the situation closely. Meanwhile, Michigan Governor Gretchen Whitmer says she was pleasantly surprised to see President Trump propose a ban on flavored e-cigarettes. His announcement came soon after she first took executive action to ban them in Michigan.
Our chief medical officer said we got a public health crisis. I took executive action, and I was very pleased to see both Governor Cuomo in New York start the process there, and the White House just this week acknowledged that they're going to as well.
Governor Whitmer says flavored vapes must come off the shelves in Michigan within the next 30 days before they start enforcing the ban. If they don't, she says, there will be penalties.